Good morning to one and all present over here. I would like to present my poster regarding pedagogical practice in physiotherapy. Regarding the pedagogy refers to the way of teaching students, whether it is theory or practice of educating them. The aim of physiotherapy skills through pedagogy is to enable the students to get thorough understanding of subject and to help them to apply those while their clinical practice and their daily lives outside the classroom. The next, I would like to focus on learning through pedagogical processes. I have mentioned a good diagram of this pedagogical process over here. So now here I have mentioned the components of pedagogical processes. Those are followed in physiotherapeutic practice every day. Assessment and adaptation. It includes the everyday assessment of patient, its learning approach from the respective teachers, and mainly the adaptation to everyday clinical practice guidelines. The next is observation and listening. Mainly focuses on listening skills so that listening to the patient while taking history is and keen observation is very important. Third one is documentation and narration. That is how to document the positive findings and narration to the patient and the faculties as a student is very important aspect of pedagogical practice. The final one is planning and implementation. The planning of treatment protocol according to process followed by learning method of pedagogy and followed by implementation is taken in consideration. The process are obviously followed by stepwise manner using professional judgment and by demonstrating pedagogical learning. The new innovations of learning through pedagogical processes are mentioned over here. Now, I would like to focus on the effective communication skills. So now effective communication refers to the transition between educator and students, creating a joint communication climate which changes from moment to moment as conversation unfolds, and both of them influence each other in the same way. It includes the emotional communication, non-verbal language, humor, computational thinking, reflective communication, and techno-friendly communication. The conclusion is student-teacher relationship can have a healthy future and both individuals respect the role they agreed to play. The next one is pedagogy in physiotherapy. I have mentioned the past, present, and upcoming future methodologies in physiotherapy. In past, physiotherapy practice was more likely exercise based. It was less technology used and more focused on manual techniques. At present, the physiotherapy is more practical based, more technology is used, and practitioner mainly focuses on evidence based practice. In future, telerehabilitation, global education access, and therapist to therapist communication is considered worldwide. Then, so now, hence the moral of our e-poster was to highlight the points to be covered while considering pedagogical practice in physiotherapy, what and how exactly to adapt learning and communication skill and ecological development in physiotherapy in future upcoming years. Thank you so much.